Good day, all Mrcs Part B candidates. Today we are going to discuss a new station. It's a critical care station. It is Burn Station, BURN. And in this station, there are two parts. There is a main stem, as we told before. Every station has a main stem and branches. Here, the main stem is burn itself. All the question will be about burn, and the branch will be ARDS, or acute respiratory distress syndrome. So let us go on and see the first main stem, the first part of this station. They are going to give you a stem for some young gentleman, 26, 28 years old man, who had a burn. It's a second degree burn. It involved the face, maybe the upper chest and the right arm or left arm whatsoever. Okay, so it's a second degree burn, and the major point is that this burn happened in a closed or enclosed space. So what is the first question? The questions in this part of the session are about 8 to 10, depends on the examiner himself. So it will not make a difference because you are going to get all the marks. And this is one of the sessions that you can get the full mark because burn is common for most of us. So the first question is that classify burn. What is the classification of burn regarding the type of burn to the patient? And the answer is going to be that there is a classification system. And according to that classification system, the burn is classified into 4 degrees. Okay, the first degree is first degree burn is a burn that involves only the epidermis. The skin is going to be erythematous, and this type of burn is very painful. Okay, this is number one. The second degree burn actually involves the epidermis and the dermis, but it does not involve the appendages of the dermis. Okay, so in this case here, what are the criteria that characterize this type? Because one of the questions or two of the questions may be about the second degree burn inside. We are going to finish them here. So in the second degree burn, what is the main characteristic? It is blistering. Okay, so if you remove the skin of the blister, you are going to find some pink color down. Okay, so if you press, there will be a refill or blinching, they call it, and it is so painful also. Okay, this is the second degree burn. The third degree burn actually involves the whole thickness of the skin. It will look leathery and it is painless, and usually it is treated by grafting. Okay, the fourth degree burn, this is not common for you, nobody is going to ask you about that, but it involves the skin and the underlying muscle. Okay, the second question is going to be, how are you going to manage this patient that has been mentioned in the stem, the 28 or 26 years old man who has an enclosed space burn which involves his face and other parts. So this is a critical case, and as we mentioned in another lecture before, that any critical case should be managed according to the ABCDE protocol. Okay, so you're going to start with the A, and this is the major issue here. It is the airway. So regarding the airway, actually in burn patients, your threshold for intubation should be very low. This is a very important point. Okay, why? Because they mentioned to you that this patient had a burn in an enclosed space. So there are some signs that you are going to look for to know about the severity of the injury, airway injury due to the burn, and these include actually number one, if the history included a burn in an enclosed space. This is one of the indications that there may be an airway injury. Number two, if there is some soot or blackish discoloration around the mouth or nose. Number three, if there is singeing. This is sort of, when you burn hair, there is some sort of some white discoloration of the burned hair. If you find this is a sign that there is an involvement for the airways. Another thing that you should consider is if the patient started to have some blackish or carbonaceous color, this means that he had burned his lungs also inside airways. Another sign that you want to see if he started to speak and he has some sort of hoarseness of voice, if he has stridor or wheeze, or if he's distressed a little bit, or if you measure the CO hemoglobin and you find it more than 10%, this is a laboratory investigation. These are all signs of airway involvement in burn. So in this case, you are going to consider the intubation. Other indications for intubation, if the patient is going to be transferred away, you want to intubate him because you will not know the edema in the respiratory linings and in the pulmonary linings will not show up immediately. So you do not know what will happen in the way, so you want to intubate the patient before you transfer him. Okay. Next to that, you are going to come to the B, and this is the breathing. As we mentioned before, you want to have a low threshold for intubation, and you are going to check for any difficulties because of the edema that may develop, and you also want to think about any circumferential burns. If it's all surrounding the chest, for example, you may go for ischiotomy also. Okay, finally, you are going to consider the C of the ABCs, and this is the circulation. 2 large bore cannulae are going to be inserted, and you are going to start fluid resuscitation immediately. In addition to that, in the circulation part, you are going to consider a CVP monitoring or central venous pressure monitoring, and you want to consider urinary catheter and measurement of the urine output. Okay, this patient should be ideally treated in a burn specialist center. They may ask you what type of fluid are you going to use. That question is asked in case that you did not involve it in your answer. And actually, in this case here, you are going to tell that I'm going to use crystalloids. Okay, so some examiners may ask you why you are not going to use colloids. Actually, because there is an increase of permeability of the blood vessels after burn, and if you give colloids, they are going to go to the extravascular space, and you are going to lose your fluids more. So the third space will be filled instead of the intravascular space. This question may show up. It is a professional question, and you need to know about it. Okay, the determination of the burned space, the total body total space that has been burned is important for the calculation of the fluids, as you know. So how are you going to determine the percentage? And actually, there are major 3 ways that are considered for you here. The first way is the Wallace's rule of 9. Everybody knows about it. The head is 9, anterior of the chest is 18, of the trunk, posterior is 18, upper limbs both 9 and 9, lower limbs both 18 and 18, and the perineum is 1%. Okay. The second way, some charts called Lund Browder's charts, and actually nobody is going to ask you about the details, but it is an accurate way to determine the percentage of burn. The third way, actually, which is used, is the patient's hand himself or herself. So the area of the hand here, closed area of the hand, okay, this is considered 1%. So it is a quick and accurate way to measure, especially in the trauma situation and trauma cases. So you want to know exactly what are you going to do by measuring this and calculating the fluids. Next, they are going to ask you about the approach to the IV fluids management in burn patients. And actually, in this case here, you want to be very careful. First of all, you are going to mention that what are the indications for fluid resuscitation, because not all burn patients need fluid resuscitation. Okay, if a child has a burn of more than 1%, he needs fluid resuscitation. And if an adult has a burn of more than 15%, he needs or she needs resuscitation. Okay, this is number 1. Where are you going to treat this patient? Again, it is a specialist burn urine unit or a specialist burn center. Okay. How are you going to calculate all this in one question, actually? Okay, this regarding the IV fluids. So how are you going to calculate the fluids? You are going to calculate the fluids by the Park-Lance equation. All you know it is 4 multiplied by body surface area multiplied by the weight. Okay. After that, they are going to give you some sort of weight of someone and the burn area, and you are going to calculate it. And they are going to ask you how are you going to administer or to give those fluids. And this is a very important point which contains two critical points. Number one, most of you know that also, that you multiply 4 by the body area of burn plus multiplied by the weight. This finished already. The result is going to be divided by 2, right? Half of the fluid that has been calculated is going to be given in the first 8 hours and is known to all of you, and that second half is going to be given in the next 16 hours. So within 24 hours you are going to finish the whole compensation for the fluid. The major question is that they are going to tell you that the patient had a burn at 2 p.m., for example, and he arrived to you at 6 p.m. What are you going to do regarding his fluid management? And this is a critical question. You are going now, if he came to you, if he had the burn at 2 p.m. and he came to you at 2 p.m., you are going to start fluids from 2 p.m. to 10 p.m. The first 8 hours, you are going to give half of the calculated volume, right? But now he came to you after 4 hours delay. So you are going to give all the amount that should be given in the first 8 hours in only 4 hours, starting from 6 o'clock to 10 o'clock. This is very critical. By the end of the 8 hours, since trauma or since burn, he should finish that volume, the half of the calculated volume by the Park-Lance. Okay? Next, they are going to ask you what are the indications of transferring a patient or referring a patient to a specialist burn unit or a specialist burn center. Okay, there are many indications. One of them, if the patient had some inhalational injuries, like this patient in an enclosed area, most probably had inhalation injuries, so he should be treated there. There are other more indications. I'm going to mention some here. If the patient is less than 5 years old, child, or more than 60 years old, he should be treated in a specialist center, burn specialist center. Another indication, if the burn in a child is more than 5%, or in adult is more than 10%, you should refer to or transfer to a specialist burn center. More other indications, if you suspect any criminal act, if you suspect that it is non-accidental, you should consider this. If the patient had chemical burn or high pressure steam burn, he should be also treated in a specialist center or unit. Actually, there are many indications there, but you want to mention most of them. You want to mention also that if the patient had a burn in some sensitive area, if he had a burn on his face, for example, or on the palms of the hands, or the soles of the feet, or in the perineum also, you want to shift to a specialist burn unit or center. If the patient has other comorbidities, if he is immunocompromised, like diabetic patients, or like if the lady is pregnant also, these actually need special care. Okay. Otherwise, some cases can be managed in the ward if the surface area is small and there are no other respiratory complications and so on. So usually they are not transferred to a specialist center. The next question is going to be, what are your parameters? What are your indications that your resuscitation is going well? You are doing fine with the patient. Actually, you have two complications because of the fluid resuscitation. It is under resuscitation and overload, right? So there are some indications that you want to consider. Number one, you want to consider something called the cardiac index. And the cardiac index has some components. They include urinary output. This is very important. You want to be sure that the urinary output is more than 0.5 per kg per hour. Okay, the urinary output or rate. Another more indication related to the cardiac index, it is refill, capillary refill. The periphery warmth, also temperature, outside warmth, you want to check. Another way to check or to follow is the central venous pressure. Okay, you have a CVP line, so you want to check it also. Another thing actually is the core temperature. You want to check the core rectal temperature or something like that. And another indicator for your resuscitation direction is the hematocrit. The problem in hematocrit is that if the patient had some sort of transfusion, blood transfusion, or he had hemolysis, which is common in huge burns, so in this case, it will not be reliable. Okay. Finally, and the last question regarding this main stem, they are going to ask you about what are the complications, most common complications of burn. And in this case, here you are going to mention acute respiratory distress syndrome or adult respiratory distress syndrome or ARDS, as you wish. And this part of the station is going to be discussed in the next lecture. Thank you very much and see you later.